age-related loss may not be truly age-related anymore, and it may be more that
Mm.
cumulative approach. So, above age 70, about 40 to 50% of patients have some degree of loss or a significant loss. So as that goes up, as we go up in age, that percentage gets higher. If you find yourself asking people to repeat frequently, that's one of the biggest things
Mm.
we see. If in noisy environments you're having a harder time following the conversation and engaging in the conversation, if you find yourself or someone else withdrawing or not doing things because it's a noisy environment and, oh, I just can't hear there, I don't want to go, those are some of the scarier ones for me.
Welcome, Dr. Johnson, to Spotlight. I'm excited to have you here today to teach our audience all things audiology. This is a topic that not everybody thinks about until it happens to you. But Dr. Johnson is one of our local doctors who serve in our senior living communities and just serve our local communities and helps us with all things audiology. And he educated our audience, is really insightful. And our audience just gave me the greatest feedback. So I'm happy to have you here today. Happy to connect with you again and just give our audience a little bit of insight in what you do. So thank you for coming.
Awesome. Thank you so much for having me and that great intro.
Tell me a little bit. Not everybody thinks about getting into the world of audiology, and like in this world with working with seniors and all things geriatrics, I find that there's some careers people just don't think about, like podiatry. And audiology is also one of them. So what was it? You are a young man, you are in this profession, you're serving seniors and also others as well. But what got you into this field?
It's a little bit of a combination of technology, education, psychology. It's a good mix of everything. You get to talk to people all day, which I love doing. And yeah, you get to educate people. Like you said, not a lot of people think about audiology or what we do, or really until they truly need us, or they think about their grandfather's hearing aid from 30 years ago. So it's a fun field.
Yeah. Well, and I'm just assuming that a majority of your clients or patients, what do you call them? Clients or patients?
Patients generally.
Okay. So, a majority of your patients, thank you, they are going to be seniors. But I also take it that you probably serve a lot of people who aren't seniors as well.
Correct. Yeah. So, I think 10 years ago, primary age or the average age was probably 75 or above. I think with recent trends of wanting to stay on top of healthcare, we're seeing younger and younger patients. So it's not uncommon for me to see a 30-year-old on my schedule anymore.
Okay. Why do you think that is?
Yeah, I think part of it is the environment that we're in. So, we're always having headphones in, music playing. The cities we live in are pretty noisy. I think people are also a lot more aware of health concerns and they want to be
Mm.
proactive versus reactive. And, people want a baseline just to say, hey, I'm not having trouble, but I also don't want to get to a point where I am having trouble. So,
Mm.
yeah.
That's true. Now, talking about proactive, and this is totally off like the geriatric side of things, but I mean, how do we prevent anything? Is it just by better daily practices? Is there things that we can do besides not listening to loud music or blasting our headphones?
Yeah, I mean, I think music is one of the big ones we see. So, average use of headphones, we want to keep it down to a minimum. We don't want to have the volume set on max, and we have loose guidelines that we recommend as far as, 50% volume for a few hours a day, but really trying not to, blow your ears out. I think that's preventative is always better. So, yeah,
It's a
going to a
good place to
concert.
start.
Yeah, exactly.
Yeah. So, okay, we've got our like new age or younger generation who's coming for preventative care, just to check up. But then we have our seniors, and with our seniors, are there anything or is there a specific lifestyle that impacted a majority of seniors where you're seeing them as your patients now because it's something they did in the past in their era that was a little bit more common? Does that make sense?
Yeah, yeah. So I think, as a society, we're a lot better at recognizing risk now. So, 40 years ago, a
Yeah.
carpenter never wore hearing protection. They'd be using these saws that are getting up to 100 dB and they're just running it for 8 hours a day for 40 years. Now, there's a lot more protection with OSHA and NIOSH to help prevent that from going on. You also think about the concerts. I mean, you see the Who or the Beatles, many years ago. It's probably a great show. Great
Right.
ways to lose hearing.
Absolutely. So what now today, what are you seeing as a result of that? Is it just typical hearing loss, or what does that look like?
Yeah. So the most common type of loss we have is what we call sensory neural loss, meaning it's more nerve related. We're seeing it's from damage or exposure to sound, life experiences. Genetics can play a role, some medications as well. So, when we think about hearing loss, a lot of it's cumulative. It's not usually one incident that causes this catastrophic hearing. It can, but usually it's more just concert here and there. Time can play a role as well. So yeah, we like to think of it as a long addition. Uh,
True. Right. I'd like to kind of relate hearing loss to my husband. I think a lot of wives do this. So there's a difference between selective hearing, right, and true hearing loss. So I always, talk to my husband and I'm asking him something, and sometimes I could be looking at him. Sometimes I might be washing dishes or cooking and talking to him while he's in back of me. And I'm just going to claim this, like many husbands, he is continues to do his thing and not hear me. But that is more so, I believe, selective than actual hearing loss. And I think there's a difference. Obviously, there's a difference between real hearing loss and selective, but there's also age related and not age related. We kind of discussed that. There's some things that you can do naturally. You listen to loud music, you go to concerts, you have a certain lifestyle, you have headphones in nowadays. There's just so many things that could really cause some type of hearing loss. But is there anything that is just typically age related? I mean, in just aging, in the aging process, without these hearing factors or these noise factors like loud music or loud sounds in our work environment. Is it just something that happens?
so good question, and I do want to start by saying, we help hearing, but we don't help listening. So listening is a
Yeah.
skill, hearing is. Sorry,
Right.
bad. But there's a structure in the ear that our theory has been that there's little cells that die off as decades go on. There was a recent article talking about age-related loss may not be truly age-related anymore, and it may be more that
Mhm.
cumulative approach. So, yes, as far as science goes, we're seeing more as time goes on, we lose certain features of hearing, and we expect to see it with certain ages. So, above age 70, about 40 to 50% of patients have some degree of loss or a significant loss. So as that goes up, as we go up in age, that percentage gets higher.
That's a really significant amount of the population.
Yep.
I didn't even think it would be that high. Okay, we've got above 70, we've got, definitely some hearing loss. The potential to have hearing loss is pretty significant. Uh, how do we know? What are like some of the signs that we know we or a loved one is experiencing some hearing loss? And it's not that selective hearing that we talked about earlier.
Yeah. So yeah, some of the best things to look out for when you're around someone with hearing loss, or if you yourself are not sure, should I get my hearing checked? Where am I in the process? If you find yourself asking people to repeat frequently, that's one of the biggest things we see. If in noisy environments you're having a harder time following the conversation and engaging in the conversation, if you find yourself or someone else withdrawing or not doing things because it's a noisy environment and, oh, I just can't hear there, I don't want to go, those are some of the scarier ones for me. And that last one in particular, when I hear someone say, hey, I stopped doing this because I can't hear, that's a very clear indication that you should have your hearing checked and address any concerns that are there.
Yeah. Well, and absolutely, because that just when I hear that alone, you don't want to go out because you don't hear well. To me, the first thing that comes to mind is okay, socialization, depression,
Yep.
um, isolation, all of these things, especially with our seniors. That's huge. That's a big problem. So you're saying if we see somebody who or hear about someone who may be kind of declining in a sense of socially declining or removing themselves from those the society or whatever the type of engagement that they're used to, because they may be having a hard time hearing. This is a very, very big indicator that they need to go have their hearing checked and they need some support in this area.
Right. And one thing I always tell people, just because you get your hearing checked doesn't mean you have to get a hearing aid. The baseline is a great tool. Hearing aids are
Mhm.
great, but people are afraid, oh, I don't want a hearing aid, so I don't want to get my ears checked. It's like, well, it should be important to get your ears checked and make sure that you're not missing out on things. You get to make the decision on whether you accept treatment or not. But yeah, depression, anxiety, social isolation, they've all been linked with hearing loss and untreated hearing loss.
Mm,
So your risk factor for all
mm.
those goes up with untreated loss.
Yeah. This conversation brings me back to a conversation I had a while ago with a dentist. And the dentist was telling me how, and I may completely butcher this, so don't hold me to this word for word, but um, he was telling me how healthcare will only provide, or Medicare, Medi-Cal, your insurance, that will only provide coverage for you to see a dentist twice a year for your every 6 months for a checkup, right? So everybody goes, they do their, hopefully they'll do their checkups twice a year for cleaning and X-rays. I think X-rays are even limited to, for some insurance carriers, like once a year, right? But the truth is, what he suggested is that you go to dentists more often for cleaning, more often for your dental, your x-rays, your checkups, because there's so much going on in our mouths that we need more care and attention there. And I'm wondering, is it the same in the world of audiology?
Yeah, I mean, Medicare, for instance, will cover a hearing test if it's medically necessary. So they'll cover it once a year. If it's more frequent, they generally will not cover it. And if it's for the purpose of maintaining hearing aids or treatment, then they won't cover it. So Medicare often will cover things to show there's a problem, but they don't always advocate as far as audiology goes for long-term care.
And
Yeah.
I think you just called out something too. This is not preventative, right? This is treatment.
Yeah. So yeah,
That,
and we look at all the risk factors. Sorry, I didn't mean to interrupt, but we look at all the things that can go along with not taking care of your ears. Cognitive decline being one of the largest things that we're seeing right now. ER visits increase, falls risk increase with untreated loss, social isolation, depression, anxiety. All these factors, and it's frustrating from our standpoint that patients then generally have to pay out of pocket for treatment when realistically we could be saving so much money from a whole health perspective. I've got a big soapbox on that, but I'll try and stay off.
right. Eh, I was going to ask you, I think you just covered a majority of it, but what happens if somebody goes untreated? And I think we just kind of ventured into that realm. It's the depression, it's isolation. There's other medical conditions that can occur as a result of untreated hearing loss, right? I feel like this is be a major cause for incidents like falls or things like that, because you can't hear.
Yep.
Have you seen a lot of that?
Yeah, I mean, we see it on a regular basis. People come in with a concern of, I don't feel safe. I lost my footing. I fell, and we test their hearing and we're going, well, if, you heard the car coming behind you, you wouldn't have startled. You would have, probably moved over a little bit instead of, having a startle, which led to a fall, which led to a fractured hip, which led to a, 3-week stay in a, skilled nursing. Anyways, it's a trickle effect.
Right, right. And what about like hearing loss in relation to cognitive decline? Is that something that you're familiar with?
Yep. So there's been a lot of studies recently, and Dr. Franklin from Johns Hopkins has done a ton of research in this area, and his original article was published in 2017 in The Lancet, and it was talking about modifiable risk factors for cognitive decline. Of that, there's 30% that's modifiable, and of that 30%, I think it was 9 or 10% is untreated hearing loss. And it starts earlier than age 70. It's usually around 40 or 45 where we're seeing that the biggest impact can be. A follow-up study showed that treating the hearing loss, seniors actually scored higher on memory and cognitive testing with certain other risk factors when they had their hearing loss treated properly, which was really cool to see. I mean, you think about how many patients or how many residents or whoever is out there who has some degree of cognitive decline, and if they've never had their hearing checked, how much of it is truly cognitive decline or how much is it other aspects?
And this sounds like it's very much, in a sense, it's preventable. Gosh, this is such an important topic. This is so important for people to go and get their hearing checked and be more. I just so many people have to be their own advocate, and that's the reality in the healthcare system is we have to be our own advocate. So, what I always encourage, especially seniors, is that you really have to voice your concerns. You really have to stand up for yourself. And if there's a concern, if you're not feeling well, if you think something's off, you have to tell somebody that can help you make a difference. Especially when it comes to your dental, your vision, your hearing. These are all the basics, the
Yep.
basic functions, but it leads to so much more.
Yep. If you can't eat, you can't sleep, or can't eat, you can't see, you can't hear. I mean, that'll impact your quality of life tremendously.
Absolutely. I come from the world of senior living. And so in our environment, we see a lot of our residents, we see them go through different behavioral um, conditions, if you will. And so you've got residents that can really kind of advocate for themselves. They're independent. They really can articulate how they're feeling. And then you have some who are not independent. They're more on that assisted side or even memory care, and they need somebody to support them and guide them, or even understand their signs and cues of how they're feeling, or even any kind of decline that they're having. But not everybody has that luxury to have a caregiver, like in a senior living aspect, or even at home, there's caregivers as well, or a family member that's always watching over them. But for those who do have like someone that's supporting them and helping them, is there anything that you can say, hey, this might be an indication or a change in behavior that can lead you to maybe assume that there might be something going on with that hearing, and this is a good time to bring them in?
Yeah, yeah. I mean, I think if you are noticing that they're kind of withdrawing, they're not their normal self. Sometimes we could see anger coming out or frustration. I know
Mhm.
with a very close person in my life, um, if they dominate conversations, oftentimes they talk a lot because if they're not hearing well, it's easier to just control the conversation by talking. And if you stop and if I ask a question and they don't hear, then it makes them look bad. So I had a close person in my life who talked a ton. And great, I loved his stories, but it was a clear indication that when he got hearing aids, it was like a whole different person. He was engaged in the
Mm.
conversation. Yeah, I think withdrawal is a big one. I think, just change in their daily activities as well is a big one.
That's important. And now you're helping me to learn to listen and not talk.
My
So
wife would
you had
say that
mentioned
I
that
should
hearing
listen to
aids.
myself too. Sorry.
um, so you said hearing aids, right? That's obviously a solution. Are there any other ways to treat hearing loss?
Yeah, I mean, there's situational devices you can get. So there's like if we've had patients who are bedridden and they don't talk a lot to people, for whatever reason they can't manipulate the hearing aid themselves, and TV is their primary sound source. A good set of
Mhm.
headphones, a Bluetooth set of headphones, or TV ears work really well for that. There's programs for more mild losses to help kind of fill a gap until they do end up getting some sort of treatment. There's something called a pocket talker, which is a pretty rudimentary amplifier, but they work great. If you just need to make sure things are loud enough, hospitals should all have them. They're great tools. And if you do, meet with someone and they just can't hear you, having that's a good way to have it be universal. You can give it to people, have them put headphones on, and you just talk into a microphone.
Mhm.
So those are cool low tech devices that work really well.
And I've seen for in-home, there's, I don't know what they're called, but there's telephone devices that have almost like a little a display, right? So if they can't
Yeah.
hear, they can read The I don't know if it's just a voicemail or if it's the actual conversation that they're able to read. Are you familiar with those?
Yeah. Yeah. So there's a few programs federally and run by the state where if you have hearing loss, your audiologist can sign off a form where basically you can get a phone free from the state or federally, and basically it'll basically write out everything that the person's saying. So it's real time, slightly delayed,
That's
but
awesome.
yeah, they're great.
That's awesome. Yeah. So here and hearing aids, you talked to this a little bit at my network, and this was quite impressive in a way that I was shocked. The cost of hearing aids, right? They are a little bit higher than we would like, right? Because we want it
Sure.
accessible to everybody. But there's a difference in quality and a difference in service. And I'd love, for the sake of our audience, to understand what that is. Not every hearing aid is treated the same, right? And we should know what we're getting into when we're making these types of decisions. So, can you go over that a little bit for us?
Yeah. There's a wide array of costs. And depending on which area you're in the country, it can range from, X amount to significantly higher. I don't want to throw a number around because, I think it's just hard to know in that region. But
Right.
part of the cost of the devices, unfortunately, is due to insurance companies not covering devices. So if insurance is not covering it, generally it's more out of pocket, which most plans, Medicare does not cover hearing aids. A lot of insurance companies do not cover it. Um, Part of that is the device, part of that's the fitting of the hearing aids. And usually there's some care that's involved. You can go to a big box store and get hearing aids for cheap, but what a lot of people don't realize is who is actually helping them. So you could see an audiologist, but most of the time it's a hearing aid dispenser. Not saying anything bad about hearing aid dispensers. I was one before I got my doctorate. I'm very familiar with them. I worked for a large box chain. I understand how they work. I think they're great for some people, but there are limits where you shouldn't go to a big box store and you should go get personalized care. That being said, there are audiologists that don't follow best practices. So I think ensuring that patients, when they do go to a place, they find someone who's credible and will follow and do the right thing versus the quick thing.
Right. And it's, I feel like it's like most services, most things that we need to invest in. You have to really make the right investment to ensure that there's going to be the longevity with that, right? So the right service to support you, the right product that's going to last long term and not just going to be here for short term.
Yeah.
Um,
I think a
you
good
and
thing to Oh, sorry. I think a good thing to
no.
note too with hearing aids is, the device only does so much. If the person fitting
Mm.
them is doing everything they should, I use the analogy, my father-in-law is a carpenter. I am not. I am a very novice. If I have a nicer saw than him, his line is still straighter than mine. And it's not the saw, it's the person using it. Hearing aids are only
Right.
a part of the solution.
I love
Sorry.
that. That's a great analogy. You have to really go to the experts. I can order glasses from zenny.com and they're, 30, $50, but they fog over very quickly. They're cheap material. I don't have support. I can't custom fit them. So there's just a difference in quality and in service, right? You want to go to the experts. And I know there is definitely some misconceptions in the world of audiology. There's misconceptions about hearing loss, hearing aids, the seniors being taken advantage of. But the truth is that it's just, this is the system. This is the world that we live in, right? And there's a high cost because the insurances aren't necessarily helping us out a
Yeah.
tremendous amount. And so we have to incur that cost personally. And I would love to hear from you, like, what are some of your experiences with being able to help somebody who maybe came from one of those big box stores that possibly had a hearing aid from one of those places, but didn't have those services and didn't have the support
Yep.
and needed you to help them through that?
Yeah, I mean, and just a quick note, there's no audiologist that would want to charge more than what we have to. Well, let me rephrase. There's always bad apples, but most of us we charge what we have to in order to keep everything going and to provide the level of care that we need. So, there are ways to cut costs down, but usually service goes with it. I know myself, that's not something I'm willing to sacrifice quality over costs. But yeah, I mean, I've seen patients coming from large box stores or online hearing aid vendors who sell hearing aids, and the patient goes back, goes back, goes back. They come in, they see me, they're frustrated. We do a quick test to verify their hearing aid. We see it's way underfit. We fix that fitting, and the patients are stoked. They're happy. They can hear. They can enjoy conversations. They don't go to the restaurant at a senior living community and say, "Hey, I can't hear. There's too much background noise. I can actually participate now." Except for my friend Jerry who mumbles, I hear everybody. So it's been, a really great experience of just seeing that difference.
I love that. And you've been super helpful in our communities. I mean, you've come in, you've helped our residents, you've worked with them one on one, whether it was someone that was wanting to make that transition from who their current provider is to you, or whether they had hearing aids in the past or not. You've really been a tremendous support, not only in our senior communities locally, but just in our local community. I've seen you out there, so I definitely trust the integrity that you carry among yourself and your practice. But I'm also like going out there and talking to people. I imagine that it can be challenging because not everybody is open to the idea of getting support or getting hearing aids. How do you overcome that?
Yeah, that's one of the toughest things. And my running joke is I'll never convince anybody to do anything they don't want to do. So, I can lead with
Yeah.
information. I can give them kind of their feelings, read back kind of what they've said. I noticed you complained you weren't able to hear at this restaurant. What if you could hear better in that environment? Did you hear what they said across the table? Oh, they said this. What do you think would help you? Kind of restructuring and allowing them to figure out, hey, how do I help myself do better in this environment? There's not a single person who wants a hearing aid. People want the option of hearing better. So, framing it in the sense of this is going to help improve some aspect of your quality of life versus here's an apparatus that's going to make things louder. Um, you know, it, it is really tough. I think pointing things out. I've had people say, "How do I know if I need a hearing aid?" And even if they have loss and they say, "But I don't perceive it," I'll have them go home with a notepad and just jot down, keep a tally of every time they ask someone to repeat, or every time they miss something in a TV, jot it down, and then in a week say, "Oh, I missed 30 different, words. What was the environment like?" And just, I think it helps give the person an idea of what they're really missing.
Yeah. And that's such good insight and just a good practice. I think this goes for many health issues, right? I just took my son to the doctor. Is totally not related to hearing, but related to what your suggestion is, um, my son has had these constant headaches for probably 5 years, and we couldn't really figure out like what's going on, where are they coming from? And I've seen multiple doctors, and finally, the last doctor I just saw, um, he said, "Why don't you get a notebook out?" And
Yeah.
every time this is happening, start writing down what is the environment? What did you eat? What's happening? Because we can't sit here and be in all of our patients' lives at every moment. We can't
Right.
sit here and guess, right? Until we're right. You have to help with part of that process. And also helping with part of that process brings in awareness.
Yep.
So I think overall, when it comes to your health and wellness, as a patient, you also have to be more proactive
Yep.
and be willing to be part of that solution. Not only does it help the doctor, but it really helps you get greater insight on what's happening in my body. What are
Yeah.
these changes? What am I experiencing? And actually, when is that happening and why? So
Yep.
it's a little bit more of a accountability, but also a willingness to be part of that diagnosis and part of the solution, right?
Exactly. Yeah, I mean, you've said it best. You have to be an advocate for yourself in any aspect of your health because realistically, if someone comes and sees me, if I spend an hour and a half with them, which is our, a typical appointment, that's an hour and a half of a 75-year-old's life. I mean,
Right.
you think about it in that terms, they're going to know much better about how they perform than I do. I can
Mhm.
relate what their experiences are to what we're seeing, but they know themselves better than I do.
Absolutely.
Yeah.
There's a lot of people that are going to be listening to this. And I'm wondering what would be your advice for someone, whether it's a individual that may be having some hearing issues, maybe they absolutely know they have hearing issues, or it's a loved one that thinks I have someone that I need to watch out for. and I need to go to someone that I can trust. And this could be, in this that we're in, there's many options, but there's also people in more rural areas who don't have a lot of options. What would you suggest in finding the right person for them to help them walk through this in getting the best care?
Yeah, no, it's a good question. I think the biggest thing that I would advocate for is just to do a little bit of due diligence on who you're seeing. If you have friends who have gone to see a provider, ask them their experience. We have best practices in audiology, and realistically, there was an article recently saying about 30% of them follow best practices, which is shockingly low. It's awful. I mean, that is horrendous. There's no excuse for it. So finding a practice that follows comprehensive best practices, you will do better. If Costco is your only option versus an online hearing aid retailer, go there. Unfortunately, there are places where there is not good access to care. And so I've heard of people flying to clinics to get hearing health care, which is crazy to me. And it's sad. I think that sometimes you have to make the best of what you can. There's no one answer for everybody. So finding someone you trust, working with that person, trust is huge. I think with every industry, if there's no trust, you shouldn't work with that person.
Very true. And we're so lucky to have you, Dr. Johnson. I'm just incredibly grateful for our residents in our community. I know that we can trust you and rely on you. So thank you so much.
Oh, thank you. I appreciate it. And I appreciate you having me on here. This has been so fun.
Yeah, thank you very much. Audience, if you need to get a hold of Dr. Johnson or have any questions, feel free to look in the notes. But thank you for coming, and I look forward to our next conversation.